basically, this clicker question tells us we need to go home and review this material. Let's quickly go over them, okay? So what we're trying to say is this drug is an antagonist of your nicotinic receptors globally, okay? So it's going to affect all the nicotinic receptors. So what is the nicotinic receptors are found? Find it only in the sympathetic, parasympathetic, or both? Both. So it's the pre-ganglionic neurons releasing acetylcholine. The post-ganglionic neurons will having expressed those nicotinic receptors affecting that. So, so if you are affecting, basically you're affecting the second order motor neurons in your autonomic nervous system, do you think it will change the firing rate of your preganglionic neurons or not? Louder.
No.
Oh, very good. Okay, so you want affecting your preganglionic neurons because of that's the one you don't have receptors for the preganglionic neurons. So how about the release of the norepinephrine from adrenal medulla? So adrenal medulla, the adrenal medulla is a modified sympathetic postganglion, right? So basically, the adrenal medulla have nicotinic receptors expressed on themselves. So the acetylcholine release, the nicotinic receptors will respond to the acetylcholine releasing the norepinephrine or epinephrine. If you have a block the receptor, of course we're going to have a decreased releasing of norepinephrine and epinephrine from the adrenal medulla. Okay, so the release of epinephrine from postganglion neurons in the sympathetic nervous system. I'm sorry, there's a typo here, and I give those people who should see some, some credit. We're going to say if the release of norepinephrine from the postganglionic neurons in the sympathetic nervous system, then that answer would be C is not correct because yes, it's going to be affected. Okay. The voluntary contraction of the bicep, skeletal muscle also have the receptor, the nicotinic receptor. So we're of course going to affecting your skeletal muscles. This is also something when you smoke, you feel like kind of energetic. Your muscles are kind of maybe contracting. This is because of the activating of the nicotinic receptors on the skeletal muscle. So B, C, D. If we change the C from epinephrine to norepinephrine, B, C, D all correct. Okay. So B, C, D all correct in terms of they are going to changing their firing behavior or contractile behavior. The A is the one who is not going to be affected. So A is the correct answer for this question. Okay. Questions? If you have questions, yes, go ahead.
The question up there is different than the one in our slide.
Oh, one in your slides?
Yeah, ours says which of the following events was the use of this drug?
Oh, sorry, I changed that. So the one, if you're looking at, I have to explain. The slides you have probably you downloaded not yesterday. So the ones I actually find a couple mistakes on the slides and I updated it. So last night I updated the version you have. So if you have if you see differences between my slides and your slides, that's probably because you have the earlier version. Yes.
I downloaded it this morning and it's still wrong.
Really?
Yeah.
Okay, I will change that. Okay. Function of the sympathetic nervous system. A lot of this is already kind of a review, and I'm going to go a little bit fast. So you basically will see a very energetic response that is due to a very stressful situation. Okay, like when you want to run away in a situation you find it's very fearful, and or you're going to take an exam and you're trying to increase your sympathetic output to get a better output. So those are mediated by the sympathetic nervous system, the fight or flight. And there are several functions that are involved in the sympathetic nervous system, increasing the contractile force for the cardiac muscles, so your heart can pump faster and more stronger. And you have the dilation of the air passageway, which is through the beta-2 receptors, now we know. You also have your boosted energy availabilities, including the glycogen breaking down, triglyceride breaking down. You have your muscle contraction, increase the body temperature. You're going to increase the sweating, either through the acetylcholine receptors finding the globally sweat glands, or local glands of the alpha-1 receptors finding in your palms and the sole. And then you're going to also decrease the non-essential organ activities. So the beta-2 we talked about here, also including some of those smooth muscles found in your GI tract and they find in your urinary system. So you don't want to use the bathroom when someone is chasing you. So this is all these these GI tract and the urinary and reproductive system actually going to decrease when you have a fight or flight situation. These slides actually we mentioned quite a lot before already. What we want to say in this slide is actually the fight or flight is amplified by epinephrine that is releasing by your adrenal medulla. Okay, so epinephrine really is a greatly enhanced sympathetic nerve effect, and it reaches your body a little bit slower than the sympathetic, the other division through the sympathetic division. So this is releasing the hormone epinephrine and reaching to the global region of your body. So have a global effect. And also epinephrine has a differentiated effect. I don't know if many of you have noticed or not. So first of all, this is a alpha-1 is going to responding to epinephrine as well, causing some of the blood vessels to constrict. So you basically constrict the blood vessels, like you losing, sometimes your face look pale, and the skin, and those blood vessels going to your skin were kind of constricted during the fight or flight. You may losing kind of looking pale. That was the constriction happening through the alpha-1 receptors. And you may have beta-2 receptors is responding to the epinephrine as well and causing the vasodilation. So what kind of muscles or the vessels that needs to dilate during a fight or flight? Skeletal muscle, right? That's a big one. So you can see that effect on the beta-2 receptors cause increase of the blood flow to your skeletal muscle and the heart. And so that is a differentiated effect that can be found in the epinephrine. So epinephrine can causing vasoconstriction in certain areas, but causing vasodilations in other areas. And I'm asking you, how could these come about? And the reason is because of different receptors. Okay, so the receptor different. And you can see these different drugs associated with how our current funding here. And if half of our population over age of 50, you're going to somehow using the beta blocker. It has a lot of functions to help you reduce your blood pressure and all that. So this is due to our function, what we described here. Okay, I'm going to this last clicker. I know I have only 1 minute, so I give you probably 30 seconds to answer this question. When we say extensive sweating, we talk about it globally. Okay, so I should have added globally sweating. So do you think this MAO inhibitor will causing any of these options listed here? 40 seconds maybe. It's still people clicking. Okay, Okay, I'm going to stop here. So sweating, again, sweating is, if I say global sweating, this is through acetylcholine receptor, which is your muscarinic receptor, okay? So better choice will be E. If the A is, we say locally, and then that A is correct as well. Okay, so good luck to your practical this week, and let me know if you have any questions.